Pinellas Watch, in collaboration with Community Patriots Pinellas Official and Defend Florida. If you live in Pinellas County, please visit the 3 groups on Facebook. Think globally, act locally. Put city, county, then state politics above national politics and national headline news. We are all we have. Ladies and gentlemen, are you ready for Health Theater? From the land of Covidia, Slick Rick Kriseman!
I think we're 6 feet apart, everybody from me, pretty much, looks like. All right. Given the distance, I'll go ahead and... instead of the legislature and the governor preempting cities and counties, they should be calling us all up and saying thank you to cities and counties. Because what could have happened in the state of Florida, as far as the number of hospitalizations and the number of deaths, didn't happen because of the actions that cities and counties took.
Let's stop you right there, Slick Rick. So let's look at Manatee County, who lifted their mask mandate in October 2020. And let's look at masked Pinellas. We got masked Pinellas versus no masked Manatee. The following data is sourced from the Florida Atlantic University COVID tracker, assembled by data scientists and interfaced with the Florida Department of Health. All right, so here we go. Masked Pinellas versus no masked Manatee. So the cases are based on a 7-day rolling average. And we also have the hospitalizations. So the dark blue are the Pinellas cases on the 7-day average. The light blue is the Pinellas hospitalizations. The dark red is Manatee 7-day average cases, and the lighter, I guess, pink or dark pink would be their Manatee hospitalizations. So let's look at, okay, so no mask Manatee lifted their mandate basically late September, so I'm calling it October, right? And let's look at the curves. Look at the data. Look at the data. This is empirical data of what we have observed after the chips have fallen where they may. We have no mask Manatee versus masked Pinellas, and they're basically following the same curves, right? And we have Manatee with significantly lower cases and hospitalizations. Now, we are going to get to that population density issue. For right now, what I did is I adjusted for population. So the 2021 projected population right now is at 978,872 for Pinellas, 420,985 for Manatee, right? But I adjusted for population. That's previous graph. So I have the percentages. So look at how closely the cases, the dark blue for Pinellas, dark red for Manatee, look how close those cases track with each other. Virtually no difference. No difference at all. And again, I'm going to hammer some more population density, but right there, adjusting for population, as far as cases are concerned, they're virtually identical. So what? Inconvenience the whole public with masks and threaten them with fines and harass businesses and basically ruin people's quality of life for an ineffective intervention. An intervention that is not needed in Manatee where the same results happen. Okay, so let's look at the hospitalizations. So we have light blue for Pinellas, the darker pink for Manatee. Wow, huge difference. Manatees had lower hospitalizations adjusted for population since October. And then if we look all the way towards May, masked Pinellas finally catches up with no mask Manatee on the hospitalizations. So if that's not enough, we can hammer some more things home. Slick Rick also talked about deaths. So let's look at, what I did is, I wrote deaths in the chart. It's really the case fatality rate. So that's basically the fatalities measured against the case positives. Look at that. Manatee was lower all the way, basically a little higher than Pinellas in October, dropped way below as Pinellas rose, kind of caught back up to Pinellas a little bit, and they both have taken a steep decline down, with Pinellas, with their case fatality rate slightly above that of Manatee. So again, that's not really holding water. We have no mask Manatee since October, 7 to 8 months of no masks, right? and we have masked Pinellas. So what's this, Slick Rick? We already covered hospitalizations. No difference. No difference in cases. Now we have no difference in case fatality rates, Slick Rick. All right, so I'm sure you COVID Karens out there are just raring to go, shrieking about population density. Well, here we go. Johns Hopkins University, hardly some QAnon internet foil hat, science-denying conspiracy theorists, right? Study, urban density not linked to higher coronavirus infection rates and is linked to lower COVID-19 death rates. That's Johns Hopkins University. Your beef is with them, not with me. Keep shrieking there, COVID Karen. All right, so let's look at, this is from Our World in Data. If you look at the x-axis, it's the people per kilometer squared. And then on the y-axis, we have the confirmed COVID-19 deaths per million, deaths per capita, right? So look at that. Hungary in the middle, 100 people per kilometer squared, tip top of deaths per million. And then I have the outlier there, Singapore, way more, 10,000 people per kilometer squared, lower death rate than lower deaths per capita than everybody. But then when you look at those scattered dots there, those represent countries on the Our World in Data graph. And you can look at the other countries that are 100 people per kilometer squared, like Hungary. And there's just nothing, it confirms the Johns Hopkins finding, urban density not linked to higher coronavirus infections. You have two credible sources agreeing with each other. Stop being a science denier there, COVID Karen. And then look at Canada. We have way lower, 10 people per kilometer squared, high deaths per million. All right. So if that's not enough, that's really your problem that you're a science denier there, Slick Rick. Now, I'm sure many want to get into, well, how do you gauge compliance? How do you know they weren't wearing their masks right? Okay, we're going to address that too, Slick Rick. All right, here we are on the Carnegie Mellon database, delphi.cmu.edu. People wearing masks, compliance, and we can see the compliance right here for Pinellas County. So we go look at these dates, and so look at the dates. And, you know, we want that March through April. That March through April spike. You just see the compliance has been at 90%. Pretty much for months. It's starting to go down. But as you can see, the compliance was pretty much at 90% from February all the way to April. Okay, so let's look at that uptick from March to April in the dark blue, the cases for Pinellas. So we just saw on that database high mask compliance in the 90s, basically all the way from February. March to April even at the 90s. So we have that 90% mask compliance, and cases still upticked from 5,652 cases to 6,327 cases there, Slick Rick, from March to April. What do you have to say about that? We have high compliance with COVID upturns. Look at that, October through January. Look at that big spike, October through January. 1, 2, 3, 4 months of just a steep climb. And you're going to tell me there wasn't high mask compliance back then? Well, all we have are some national news articles reflecting that, because that database doesn't go that far back. But tell me, come on, all over Pinellas County, we have nothing but people walking around with masks. I'm basically the only person in the store with no mask on, at least since I haven't been wearing them since the summer. So anyway, there we go. We have high compliance with high COVID upturns. There's no correlation between mask compliance and COVID numbers downturning. And we see that with the data right here. Let's go to those news articles. Okay, so in National Geographic, 92% of Americans polled say they wear a face mask when leaving their home, and 74% saying they always do. And then the always is up nearly a quarter since July. Well, and anyway, we got 92% mask compliance. And then if that's not enough, look at this. More than 9 in 10 U.S. adults, 93%, said they sometimes, often, or always wear a mask or face covering. So we have 93% compliance. Lines up with that previous database of 90% compliance that we saw. So let's look at this. So that was a U.S. poll. Let's look at, in the worldometer for United States cases, look at that huge, huge spike that occurred starting probably around October big peak all the way to basically January, right? 2021. From October, again, it's that 4-month spike that we saw earlier in Florida. It happened in the U.S. Oh, is seasonality a factor? No, it couldn't be. Not after thousands of years of observing that. But anyway, so then again, we're seeing that we just saw that U.S.-wide polls that were done, completed in late October, and here we're seeing these spikes October through January 2021. High mask compliance exceeding 90%. Big case spikes. No correlation between high mask compliance and COVID downturns. In fact, huge upturns over 4 months, United States wide, just like we saw in that graph on Florida. But no such thing as seasonality. Throw that out the window. Okay, so if that's not enough, let's look at cases for kids on school grounds here in Pinellas County. So it's an indisputable fact that we've had 100% compliance in school grounds. In fact, those kids are threatened, I would say put under extreme duress and coercion by mask police to make sure they're wearing their mask properly. So not only is there 100% compliance, they're making sure their masks are over their nose. And I'm sure those sadistic teachers union people love it. But anyway, so let's look at Pinellas County. 100% mask compliance on school grounds, right? Starting at September. School years usually start in September. Boom, 84% spike all the way from September to January. So how are masks effective when there's 100% compliance, but an 84% spike in cases over 4 months? Oh, now we see that 54% downturn from January to basically about now. The last time I updated this chart was late April, but you get the idea. So what? It takes a 4-month, 84% case spike with 100% mask compliance just to get a 4-month, 54% case dip still with 100% compliance. There's no correlation. There's no correlation between the data is right here, and anybody that can't see that is willingly ignorant. And Slick Rick, you need to quit the deception, man. Just give it up. And if that's not enough, let's look at Florida cases. Look at that. Again, that September through January peak, basically what we saw on that United States graph. Same just cases escalating, 80% case spike with youth ages 0 to 18. Just like that previous graph was youth 0 to 18. They're on school grounds. They're complying with the masks 100% because there's a bunch of teachers union, school board bully, Gestapo making sure they have their mask over their nose, probably to making sure they have their masks on in between bites like a bunch of freaks. But regardless, Slick Rick, look at that, 80% masks working. Are they really? No, September through January, 80% case spike. How are 4 months? How are the masks working with 100% compliance? There we go, a 52% dip. So again, what? It took 4 months of 80% spike with 100% compliance to get to that 52% drop starting in January to now. Oh, but look at those cases going back up from March up to now. Oh, the masks aren't working again, even with 100% compliance in school grounds. This is youth ages 0 to 18 during the school year. They're on school grounds. They're complying 100%. They're on the school grounds for the most part. So you give it up, Slick Rick. The data is against you. There's no correlation between high mask compliance and COVID numbers downturning. Stop it.
Aside from COVID, let's say we have a hurricane and our bridges are washed out, and I put an executive order in place, an emergency order. 7 days later, somehow I got to try and get my council back together in order to extend that emergency order. Otherwise, that emergency order is over. It goes away.
I'm so sorry to interrupt you, but he specifically said it does not, it's an outside of hurricane. He said that. Outside of hurricane, this is in place.
Well,
a sweet little honey bunny U of F journalism school grad just took you to school. And look at you fumbling there, Rick. Oh, well.
And I'll use schools as an example. Elementary school through high school, diphtheria, tetanus, Hep B, measles, mumps, rubella, polio, chickenpox. For high schools, HPV, meningitis. Those are all vaccinations you have to get. And they're required if you're going to send your kid to school or high school or college. But now in Florida, COVID-19's vaccination isn't included. You cannot require that.
Slick Rick, those are basically long proven vaccines that are FDA approved. And this current COVID vaccine is emergency use authorized, not FDA approved. What kind of voter base, what kind of uneducated voter base that does no research is believing what you're saying? I mean, wow. I mean, a high school kid probably knows this. An emergency use authorized is not FDA approved. Let's look at the documentation. And this fact sheet wording is repeat. This is for Pfizer, but the same wording is on the Moderna and the J&J. This is directly from the FDA. Emergency use authorization, EUA. The U.S. Food and Drug Administration has issued an emergency use authorization to permit the emergency use of the unapproved product. So this isn't even FDA approved, as opposed to those vaccines that you're talking about that have been long proven and are FDA approved. And this is an unapproved product. It's not FDA approved. There's no comparison between this emergency use vaccine that's, not to mention, based on a very revolutionary new unexplored experimental technology, mRNA recombinant technology, as opposed to the traditional vaccine technology. So there's just no comparison. And I have no idea why you're making the stretch, and any of your voter base that believes you is, let's say, special, and we'll leave it at that. And if that's not enough, these so-called, let's call them products for right now, the FDA calls them emergency use products in that fact sheet, right? They're in trial. So look at this, Pfizer, the trial ends April 6, 2023. The Moderna ends day 759 from when they started those trials. That's a little over 2 years. They started around, I'd say, late 2020, so we're looking at like late 2022. And then the J&J jab, the most recent, 24 months. So that might even stretch. That's probably going to stretch into 2023 for their trials. So the big difference. No, those vaccines that you talked about that schools are requiring, those are not in trial. They've been around for a while, and they're based on longstanding vaccine technology, and they're FDA approved. So big stretch there. I'd say that's a fail there.
Here, the governor there's a lot of language in this that basically gives him total power.
Whoa, let's stop right there, Slick Rick. So at the beginning of the year, January through February, Attorney Timothy Weber was just mopping the floor with your city attorneys' heads on the COVID restriction tickets. He was winning. They were having to kick it up the road because you guys were losing. So then you tried to sneak in some legislation, do an end around February 18th, 2021. You got your city attorneys, you got everybody involved to draft ordinances to where basically the court system would be bypassed to suspend an after-hours permit on the bars, to where you wouldn't have to go to court, and to where there was an amendment to clarify that one of your emergency orders is just as good as an ordinance legislated by 8 council members. And you did this all without warning, without notice, and thank God for Councilman Blackman that made it a point to put the brakes on that and get the community involved, because you guys walked in sneakily and did without warning, and you want all the power, right? One of your emergency orders is just as good as 8 council members legislating an on-the-books ordinance, right? So who's the one power tripping now, Slick Rick?
We're in consultation with healthcare experts in making our decisions. Real healthcare experts, not, radiologists like I think it's Dr. Frost, or Atlas, Scott Atlas, I think is his name. Yeah. Who's not a epidemiologist. He's not a specialist on pandemics, but that's who our governor has listened to. If you're going to listen to experts and weigh your decisions based on experts, talk to guys and gals who are experts in the subject matter. That's what we've done, and that's what we'll continue to do, and that's what we've done all along.
Nice tactic of omission there, Slick Rick. You left out the 2 other doctors in DeSantis' roundtable. So yeah, it was Scott Atlas and it was Jay Bhattacharya and Martin Kulldorff. So let's look at their credentials. And are your experts that you're consulting, do they have the credentials on the level of the other 2? Let's see. Let alone Scott Atlas. All right, so Jay Bhattacharya is a professor of medicine at Stanford University. So right out of the gate, do any of your experts have, or any of your experts on the level of being a professor of medicine at Stanford? Okay. He is a research associate at the National Bureau of Economics Research, a senior fellow at the Stanford Institute for Economic Policy Research, and at the Stanford Freeman Spogli Institute. He directs the Stanford Center on the Demography of Health and Aging. Dr. Bhattacharya's research focuses on the economics of healthcare around the world. Check this out, with a particular emphasis on the health and well-being of vulnerable populations. So, Slick Rick, do any of your experts have any expertise and credentials on the level of Dr. Bhattacharya, even on that healthcare around the world, right? World health, with a particular emphasis on the health and well-being of vulnerable populations? Vulnerable populations, the ones that die from COVID. Do any of your experts have these credentials? Yes or no? All right, Slick Rick. Next doctor that was on the round table, other than just Scott Atlas. Martin Kulldorff, PhD, is a professor of medicine at Harvard Medical School. So, okay, so are your experts that you're consulting, do they have the credentials of Martin Kulldorff, PhD, professor of medicine at Harvard Medical School? And are they also biostatisticians and epidemiologists like he is? Okay, so he's in the division of pharmacoepidemiology and pharmacoeconomics. Wow. So his research centers around developing and applying new disease surveillance methods for post-market drug and vaccine safety surveillance. So you're going to tell me this guy, do your experts have any credentials on this level that your governor, Ron DeSantis, consulted? I don't think they do, Slick Rick. So why are you being so bombastic and omitting? Basically, you're lying by omission. You know the round table had more than Scott Atlas there. You know that Jay Bhattacharya was there and Martin Kulldorff was there. But you just brought up the radiologist to make your case better, like a good ambulance chaser, right? Turned mayor.
Have you heard that from the CDC? The only thing I've heard from them is if you are outside and you're with a small group of people who've also been vaccinated and you've been vaccinated, you don't need to wear this. But when you're in large groups, you should continue wearing this. When you're indoors, you should continue wearing it. That's the CDC. That's not Governor DeSantis. I trust the CDC before I trust Governor DeSantis.
Yes, but DeSantis' decisions were based on the advice of those credentialed experts that probably have much higher credentials than the ones you're citing for your narrative. But, Slick Rick, you say you trust the CDC more? Okay, well, how about this? CDC now says COVID-19 is an airborne threat. Scientists say that's wrong. Still trust the CDC, Slick Rick? CDC keeps flip-flopping on COVID-19 testing guidelines. Flip-flopping, like you? Oh, look at this. Revised physical distancing recommendations to reflect 3 feet. So now it's 3 feet. It was 6 feet. They just keep flip-flopping, Rick. You trust the CDC, right? Oh, removed recommendation for physical barriers. So after billions of dollars are spent on physical barriers, we can remove them now for no reason. And, this is the CDC you trust more than DeSantis, who trusted these credentialed Stanford and Harvard experts. Okay.
And so if that's the case, then why isn't the CDC saying no more masks?
Slick Rick, but the CDC in May of 2020 did say no more masks. Look at this journal entry they had, scientific study. We aimed to identify randomized control trials. And look at that, RCTs provide the highest quality of evidence. So in May of 2020, what did they find? 14 randomized control trials. And then if we look to the right, 1946 to 2018, that was 72 years in May of 2020. 72 years of 14 randomized control trials, right? Which they said provide the highest quality of evidence. And what did they find? 14 randomized control trials of these measures did not support a substantial effect on transmission of laboratory-confirmed influenza. So if you want to say, oh, well, influenza is different than SARS-2, look at the particle sizes. Influenza, 0.1 micro. SARS-2, 0.12. Not much of a difference. And those masks are not filtering it, as we've seen. And These 14 randomized control trials over 72 years confirmed what we just said earlier. We saw high compliance, and we still saw the COVID upturns. So everything is confirming each other. These 14 RCTs over 72 years, already proven in May of 2020. This paper's not been retracted by the CDC. They don't have any other RCTs showing the effectiveness of masks. They just have recommendations, but here we go right here. So, Rick, if you trust the CDC, then you trust this article by default, right? Oh, no? You can just change it like a moving goalpost?
I do know the large-scale event order that the county has in place, that we have in place, the requiring the wearing of masks indoors, the 6-foot separation of tables indoors, the maintaining social distancing that we have in place, all goes away. All of it. I mean, if he's suspending all of our orders immediately, then you're going to be able to go into a restaurant and you never have to wear this again. And we can all expect to see our hospitalizations increase. Unfortunately, we'll probably see an increase in deaths, but I guess that's not important.
All right, Slick Rick. Oh, there's going to be deaths and hospitalizations if DeSantis takes our mask mandate, our precious mask mandate away. Well, let's see if this really happened in the real world. Throngs of maskless fans celebrate Tampa Bay Super Bowl win. Let's look at everybody enjoying themselves for a minute here.
You got two guys down at the bottom that are really good. Kansas City took a timeout. Weapon exchange.
Let's go.
That was a glorious time. Almost ruined by Slick Rick and Jane Castro. Anyway, all right, let's look at the data then. Day after the Super Bowl, February 8th. Let's look at the cases. Where's the super spreader there, Slick Rick? You see a super spreader? I don't see a super spreader. All right, let's look at Daytona Bike Week, right? That ended sometime in March, right? In, what is that, March 14th, the day after Daytona Bike Week. And look at this. This is America. You can't tell us what to do. More than 300,000 maskless, leather-clad bikers flex their defiance and muscles on Daytona Beach over Biden's national mask mandate. Well, let's look at some footage of that awesome time.
Disturbed.
Yep. And now let's look at the data. So we got Florida overall, Volusia, and then I put Pinellas in there for the heck of it. Where is the super spreader, Slick Rick? Do you see a super spreader? I don't see a super spreader. Anyway, where's the news articles on the super spreader in Volusia County from Daytona Bike Week? Those maskless partiers that are going to cause hospitalizations and deaths like you talked about, right? Oh, how about the other event? Just recently, April 24th. The day of the UFC 261, you see anybody with masks on in that big stadium, that large-scale event that you're talking about that needs masks? Otherwise, it's hospitalizations and deaths. If Governor Ron DeSantis takes your precious power away from you, do you see a super spreader? I don't see a super spreader. All right, Slick Rick, the charade has to stop. Just give it up. Just admit that this is a failed and ineffective policy and that you were wrong instead of doubling down on stupid.
So, one of the questions that I find fascinating is you go into a restaurant that has no shoes, no shirt, no shoes, no shirt, no service. Has anyone heard complaints about that? The fact that a restaurant or a business can say that? But for some reason, when we add masks to it, all of a sudden that's a problem. So it's okay for a business to say, you can't come into my business if you don't have shoes on, but I can't say the same thing about you coming into my business if you're wearing a mask. That makes no sense. It's about public safety. It's about health.
No, if it was about health, we'd be seeing super spreaders from all those events we saw where people weren't wearing masks. Requiring them, having no shirt and no shoes, requiring shoes and shirt versus requiring a mask is two drastically different things. Masks impede major life activities, so you're forcing business owners to cause impairments on major life activities and major bodily functions under the ADA. Major life activities include, let's look at what it could inhibit. Eating, right? You want people masking up in between bites like we're in California. Walking, cardiopulmonary is affected when wearing a mask, right? Lifting, bending, this is stuff people do while they're working. You're expecting people to work in this Florida heat with masks, and their major life activities are being impaired with the mask. They have to work, right? They have to walk, they have to lift, they have to bend. Speaking, can barely understand what people say with masks. Breathing, you're going to tell me that it doesn't impede breathing? Come on, let's stop the gaslighting, please. Learning, concentrating, thinking, those poor kids that you're torturing with masks that aren't likely to catch it or transmit it, they're major life activities. So yeah, it's a lot different if you're requiring shoes and shirt versus requiring a mask that impedes life activities. Wearing a shirt and shoes don't impede these. Major bodily functions. Functions of the immune system. Yes, wearing a mask can impede the immune system. What are some other things? Neurological, right? Facial emotional recognition. Children learn how to read through facial expressions. You're impeding that in schools. Brain, respiratory, definitely. So major bodily functions and major life activities under the ADA, those are being impaired by the wearing of masks. Wearing a shirt and shoes do not impair those major life activities or major bodily functions.
The only businesses that have been unhappy about our restrictions are the businesses that have been cited multiple times. We call them the frequent flyers. They've had 5, 6, 7, 8 citations for violating the orders. And by the way, the violations were never about their customers not wearing a mask. Their violations were always about the staff of the business not wearing a mask or not enforcing social distancing protocols. That's what they got cited for. Those are the businesses that have complained to us.
And so did those frequent flyers, with all those violations, did they cause any upturns of COVID-19 metrics in those bars? Did you trace any cases, hospitalizations, or deaths to any venues? And guess what? I did a document request to the mayor's office. You guys never responded. I have everything on record. I will probably provide that link in the description. And let's look what I asked for. I asked for epidemiological investigation data regarding the effect that venues have on COVID-19 upturns in the city. I asked for any cases, hospitalizations, or deaths traced to the venues, any documentation of that. I asked for who has the authority besides the Florida Department of Health to make decisions on where to look for the source of the upturns, where the drivers of the upturns were, determining that data actually establishes the source. And I also asked for a quantification. This is pursuant, Ron DeSantis said that when you limit a restaurant's capacity, you have to provide a quantification of the economic impact of each limitation, and you have to provide an explanation of how it's necessary for public health. Well, who can do that? Only the Florida Department of Health. You never responded, but guess what? The City of St. Petersburg custodian of public records did, and he investigated everything. And what did Mr. Chan Srinivasa say for the City of St. Pete? Good afternoon. This email is to advise you that there are no records responsive to your records request. So, Rick, you did all of these citations with no proof that any of these non-compliant venues caused any COVID-19 upturns. There was no data gleaned. There's no correlation between those frequent flyers non-compliance with driving COVID upturns, and the city of St. Petersburg custodian of public records confirmed that. And let's go further into this. Whenever there's a hepatitis case, look at this Google search. DOH Pinellas conducted an epidemiological investigation. Look at that. And that's just 4 of them that I found. The list went on. But that's what they do. That's what the Florida Department of Health does. The epidemiological investigation. That's what they do. There was no epidemiological investigation conducted on these non-compliant venues. If you cared so much about public health, you would have reported that to the Florida Department of Health. It was all over the news that these businesses were non-compliant, and the Florida Department of Health didn't conduct an epidemiological investigation. They have all that CARES money for contact tracing that they didn't use. They didn't do any investigation. So this whole thing is proof that this is health theater, because if it really was a concern, we would have seen cases, hospitalizations, and deaths traced to the places. We would have seen epidemiological investigations. Like when we see hepatitis cases, what do? They shut the restaurant down. We didn't see any of that. I mean, I hate to beat a dead horse, but look, I went on the DOH Pinellas epidemiology branch. What do? Investigate, intervene, monitor, and coordinate reporting of communicable diseases that occur in Pinellas County. They didn't do that. You didn't report it to the DOH Pinellas either. Identify the source of an agent, identify the mode and time of transmission, identify other persons who may have been exposed. So these businesses you cited for noncompliance, none of this occurred. If you cared so much, this would have happened. This has all been health theater, and you have ruined businesses and lives because of this. And you should be ashamed of yourself. You should be tarred and feathered in front of City Hall, Slick Rick.
Everyone else went about their business and did it right because they wanted their customers and their employees to feel safe. Because they wanted their customers and their employees to feel safe. They wanted their customers and their employees to feel safe. Feel safe. Feel safe.
And there we go, the heart of health theater, to feel safe. That's right, feelings over facts, Slick Rick. That is the essence of health and political theater that you closed out with, and thank you for admitting that. Until next time, kids.